you.
All right, but in terms of the speakers, Andy is here, Pauline is here, Julio is here. Sandra Harris is supposed to be representing Columbia instead of Janelle. I don't see her. Diane made it through, and we have Aretha Morgan. All right, so all of our speakers are present except for Sandra. And we do have the Columbia report in any case. All right, I tell you what, we're going to begin. Welcome everyone to this meeting of the Community Board Health and Environment Committee. I am the chair, Steve Simon, joined by fellow committee members Tanya Bonner, O.C. Kaminer, and Jay Mazur. We have a pretty full agenda, so we're going to move ahead in the hope that at least a couple of our committee members will join us as the meeting is in progress.
I just texted Sally, FYI.
I'm sorry?
I just texted Sally,
Oh,
FYI.
Okay.
And I also want to let you guys know that all the attendees that are there can speak. All they have to do is unmute themselves. So there's no need to swing an attendee over to a panelist if it's not as necessary. All right. All right.
Okay.
So, hi, this is Julio. Quick question. So in the presentation for the hospital for Andy Nieto, I sent Steve and Ebenezer the deck, the PowerPoint. So will someone be able to support us with that?
Oh,
By sharing the screen?
If the person has it, they could just share their screen.
yeah. Andy, do you have it?
Well, I think you just want to make sure that if something goes wrong, with the computer, that, at least the second source will have it.
Well, why
I
are
don't
we
have it.
thinking
It wasn't
negative?
emailed to me, but yeah, the person that has the control over the computer can just share their screen. There shouldn't be no reason unless they're not user friendly with the system and they don't know how to use it. You would have to email it to one of the committee members or to
Well,
me.
no, all of the committee members now have it. And Paola, I believe you also have it. Didn't I send it to you?
What's the title of the email?
I don't know, it should say CUIMC presentation, something like that.
I can share my my screen, no worries.
Great. Thank you, Andy.
Okay. All right. Well, let's.
No, Steve, I don't have that.
You don't have it? Okay. All right. Well, let's move forward. I'm pretty sure I sent it to all of the committee members. All right. So we're going to begin with an overview of the New York Presbyterian Hospital's assessment of the community's health needs. We're joined by Andy or Andres Nieto, Senior Director for Community and Population Health at the Medical Center. And this is a process that the Medical Center goes through, I believe, once every 3 years, has to submit a plan to the state and also to the Internal Revenue Service, I believe. And but that's that'll be sketched out in the presentation. So Andy, why don't you begin?
So just before Andy starts, I'd just like to, mention that, this is a process that started. It's a process that we're still continuing. I know, Steve, you asked for the hospital to come and make a report. So I just want everyone to bear in mind, this is very preliminary. It's not a full outcome of it. So I just want to make sure that you're aware of that as we go forward.
Yeah, actually, thank you for mentioning that. Yes. So this is not a final plan at this point. I didn't want the medical center to come to us when it was a fait accompli and it was already done. I wanted to have a chance to for the committee to provide some input during the process. And so I did ask that we have a chance to look at it while it's still in formation. So I am hoping that Andy is still open to receiving input from us in addition to all of the other input that he's already gathered. Let's move forward. Andy, go ahead with the presentation.
Great. Thank you, Steve. And it's great to be back. I was here 3 years ago when the last community health needs assessment was done. It's always a pleasure to come and speak to this committee. And I've had the opportunity to speak to you on several occasions about the work that the Ambulatory Care Network or the Division of Community Population Health does in the community, and so I'm thankful for the time you're giving me to be able to talk to you about this program. So here, can you guys see my PowerPoint?
Yes,
Yes,
All right, great. So as Stephen said, probably Stephen, you could have given the presentation yourself. This is we do this every 3 years. It's mandated by the IRS as part of the Affordable Care Act. It's also a requirement for New York State Department of Health. It's conducted every 3 years and identifies the health issues in high disparity communities. So as we go through this, we also put together our community service plans to address some of the disparities that are faced by the communities that we're targeting. Oops, sorry. And then we do ongoing program evaluation. But as you know, the hospital, the community service plan is just a small piece of the hospital's commitment to the community. In my division alone, we have multiple programs that work collaboratively with the community, and also some of our other departments like community government and community affairs that Julio is in, the accountable care organization who works with Medicare patients, and our service line programs also have programs that address specific community needs. And more recently, the hospital started the Dalio Center for Health Justice, which works to address health disparities also in the community. And so they're all part of our community health improvement. But the community service plan is, the community health needs assessment and the community service plan is a piece of this. So we started, as Julio was saying, we started this back in January with data collection and analysis of the publicly available data. We also were in the process of putting together, finalizing the community health needs assessment and the community service plan. And then in December, it goes to our board of trustees for approval. And then it goes to the New York State Department of Health. And we, as part of our report to the IRS, it gets posted on our website. It's going to be publicly available for everyone to see. If you would like, we can send you a link to the last community service plan and community health needs assessment. It's available on our website for everyone to look at. So our data collection happened with, first we looked at our patient data, where our patients are coming from. We wanted to make sure that we picked a community that we could have some impact on. So we wanted to, we make sure that we identify a community that where a big percentage of our patients are coming from. So we did an analysis of our patients. And then we look at publicly available data just to see what some of the disparities in the communities are. We look at a variety of articles and health department input. We worked with the New York City Department of Health to identify some needs. By the way, one thing that I neglected to say is that the New York Academy of Medicine is the organization that's working with us to put together our community health needs assessment, and working with us also on developing our community service plan. We also solicited community feedback. Some of you may have been interviewed by NIAM to get feedback from you in regards to what are the needs in the community. We did over 1,200 surveys, plus Greater New York Hospital Association also did a survey. We had 42 focus groups working closely with community-based organizations. And we had 25 key stakeholder interviews as well. In addition to that, we also had 8 think tanks, and think tanks are the people that, or the providers and the staff who work closely with community to make sure that we were identifying from their point of view, what are some of the needs in the communities that they serve. So, so after we compile all the data collection, we identify high disparity communities. We looked at what the health conditions are of greatest concerns for those communities, and then put together a community service plan that we would to address some of those issues. These are the communities that were chosen. As you know, New York Presbyterian is large organization. We chose Manhattan. In Manhattan, we chose Chinatown, the Lower East Side, and Washington Heights. We chose in Brooklyn, Crown Heights. In Queens, we chose Corona. And in Westchester, where our 2 facilities in Westchester are, we chose Mount Vernon and Peekskill.
Andy, could I just stop you there for a second?
Yeah, of course.
When you refer to Washington Heights, are you including Inwood?
So yes, it's the North Washington Heights and South Washington Heights. It's described on the MTA level. So it's everything in South Washington Heights and North Washington Heights, which is really Inwood. But on the MTA, it's described as Washington Heights for some reason.
I'm sorry.
That's not what we chose. That's the way it's in the data. But it includes Inwood as well, Steve.
All right. Well, who characterizes it as Washington Heights North?
So in the NTA, we looked at the NTA levels because we didn't want to just go on the zip code level. We wanted to also look at the NTA level, and the NTA.
Sorry, what is that abbreviation?
It's called neighborhood tabulation. And so, but I assure you that our work will be both in Inwood and in Washington Heights. Obviously, we have a hospital up in, at Gallen Hospital, northern area of Manhattan and Washington Heights.
Which are the numbers of the streets that are the parameters of Washington?
I can give you that. So I would say 135th Street north to the tip of Manhattan.
Tip of Manhattan is Marble Hill.
Well,
we would include Marble Hill, to be honest with you, because we have a school-based health center there at JFK.
all right. So really, this is a community service plan that covers the entire New York Presbyterian network. It's not.
That's correct.
It's not just for Washington Heights and Inwood.
Well, that's correct, but we will have, individual programs for each site. Not all the communities have the same disparities, and so we've chosen programs for each
All right,
area.
and you'll discuss that as we go along.
Sure, and we're going to focus on Manhattan, in the northern Manhattan area, not because I'm presenting to CB12, so we're going to address the areas that.
Okay, actually.
So Steve, we're following your model of just concentrating within Community Board 12.
Okay, good. Okay. I want to make sure of that. So let me correct what I said earlier, and I can't believe you guys didn't correct me when I kept on referring to this as being from Columbia, the Columbia University Medical Center. This is a plan from the hospital. It's Sandra has nothing to do with it.
I stayed silent because it's payback, Andy. This is what happens.
Okay, I can't believe I confused the two. So this is not a plan technically coming out of Columbia University Irving Medical Center. It's coming from New York Presbyterian Hospital. So the email that I sent to the members of the committee, and I think to Paola, the subject heading would have been New York Presbyterian presentation, not CUIMC.
We're used to you guys confusing us all the time.
That is correct, Steve. But we're not in a position to correct you though. So
We won't be offended by it.
Well, yeah, okay. Well, I wish to be, I wish to apologize. Okay, go, move ahead.
Okay, thank you, Stephen. So just the demographics of Washington Heights and Inwood, total population about 180,000. The race, predominantly Latino, Latinx, with 7% white, 30%, I'm sorry, 21% white, 7% black, and 3% Asian. Medium income of that community is about 52,000, and nearly half of the residents, or 46% of the residents, were born outside of the U.S. Other things interested in, and you know what, Stephen, I'm going to make sure that we change and make sure that it doesn't just say Washington Heights and that it says
Right.
Washington Heights Inwood. So I apologize for that, and we'll change that.
Yeah, you should do that. Okay.
20% of that the residents live in poverty. 26% are considered obese. 17% are considered food insecure. Some of the other indicators that were identified is that Washington Heights has about 1,300 adults with avoidable hospitalizations per 100,000 residents, compared to Manhattan, which is a little bit over 1,000. Same thing with New York City as a whole. And then
And these would be hospitalizations anywhere, not necessarily at the New York Presbyterian, anywhere at all, correct?
That's correct.
Okay.
So we're looking at data for all residents of Washington Heights and Inwood.
And this-
Avoidable hospitalizations for children, again, 587 per 100,000 residents, compared to 488. So it's higher than the rest of Manhattan. There are 31 new cases of HIV per 100,000 residents, compared to 24 for the rest of New York City. And the infant mortality rate in Washington Heights is about 4.4 per 1,000 live births, compared to 3.4 in Manhattan, so higher. One of the other things that is really interesting, we started actually asking our patients about social determinants in health. And we identified food insecurity as an issue with our patients back in pre-COVID. And about 30% of our patients were food insecure. That, as you can see, post-COVID has continued to increase. And as you can see, about 59% use food pantries among those facing severe food hardships. This is citywide data, by the way. Again, 51% use food pantries among those facing food hardship, and then 28% use food pantry. So food insecurity is a huge problem pre-COVID, and again, now post-COVID, even worse. The recommendations from the community, from community feedback on how to improve health, were to increase access to healthy foods, reduce cigarette smoking and vaping, safer and reduced drug and alcohol use, and cleaner streets and reduce crime. These are input from communities, the community feedback. These are some comments on some of our focus group. One was said high anxiety, high depression, and you know, and the issues that of mental health before COVID, and but even worse post-COVID. And then the affordable fresh fruits and vegetables is an issue that was identified as well, leading to, as we know, diabetes and hypertension and being overweight.
But Andy, mental health did not rise to a level where it would be on the previous slide, where it would there would be a substantial percentage of people affected by mental health issues.
Well, this is what our community gave us, right? I'm going to keep going, and yes, mental health is an issue that's what was identified by this community health needs assessment, but the community feedback did not put that as a priority.
Really, because in the session I attended, it was the number one item.
Yeah, well, this is data from the New York Academy of Medicine, who did the surveys and who met with the
No, but
Remember, we did over 50.
Yeah. Okay.
So for the key areas of focus for us on our community uh, uh, service plan are mental health and behavioral health. So going back to what you were just saying,
Okay.
Steve, we agree with you. Obesity and food insecurity, mental health, maternal health, I'm sorry, and HIV and COVID-19 were areas of focus that we feel we need to focus on. So the community service plan, though, has to be a combination of things. So it's the CHNA findings, right? Those things that I just identified. It has to be aligned with the New York State prevention agenda, right? We also look at our community health needs assessment 2019 to 2022 and the work that we've done there. And then identified new interventions to address some of the concerns that came up from the community service plan, community health needs assessment. Sorry about that. So I want to talk a little bit about some of the programs that we plan to put in place as part of or we're planning to put in place as part of our way to address some of the concerns that came up from our community health needs assessment. I want to talk a little bit about our existing programs. One is CHALK, which is Choosing Healthy and Active Lifestyles for Kids, that has gone further than just working with children preventing obesity. This program has been very active on food insecurity. They during the pandemic, they worked very hard working with community organizations such as El Nido Esperanza and others to distribute food to over almost 50,000 individuals, distributed over 3 million pounds of food, healthy food, and awarded mini grants to several CBOs to make sure that that they had the resources necessary to continue some of the programming. The pictures on the side are this display of some of the work that has been done. The kids that are on the side, it's our youth market, working with local youths to distribute healthy food to community residents. The picture on the top left is the food that we distribute out. As you can see, it's healthy food. We work closely with New York, with West Side Campaign Against Hunger to distribute this food to community and to some of the community organizations that we work with. The other program is the Uptown Hub. This is a program that started several years ago and now has about 800 youth enrolled into the program. During the summer, we had over 300 kids come and do internships at the hospital. We had over 190 participants of our virtual workshops during the pandemic, and we also provide psychotherapy to the kids through the hub. They've done over 1,000 psychotherapy sessions with the youth there in the Uptown Hub. And also, I want to mention that the Uptown Hub is a collaboration between us and several community organizations like the People's Theater, NIMIC, the PAL, the NAGA Y, and other organizations like that.
Remind me again where it's located.
It's located in the Public Health Building, and if you would love to, like to come and see the hub, please let me know. I'd be happy to show you the space. It's on the first floor of the Public Health Building on 168th Street and Broadway.
Oh, in the District Health Center, right on the corner.
That is correct. Yes.
Okay.
The other program is Healthy Steps.
I'm sorry, Andy. Andy, is it open 7 days a week?
It's open 6 days a week.
Okay.
Yeah, and usually into the evening because our kids, after they get out of school, that's when they usually go there. So this is an evidence-based program that is designed to build behavioral health support for mothers and their children. This is working with psychologists that work with mom especially during times of postnatal depression, and working with families to make sure that moms are getting the necessary care, that children are getting vaccinated, and so it's a tripod approach where our behavioral health people, our pediatric staff, and our OB staff working together to make sure that all the needs of the family are being addressed. We found that moms usually would bring their children for their vaccines, but would not come back for their post delivery visits, and that can be a cause for maternal deaths. And so we wanted to make sure that we combined that and had an approach to address the needs of the moms during their well-child visits. And then
Go back a second. Is that in the first bullet point? Is that word supposed to be dads?
it's diets.
No, that is, what is that?
So it's interventions.
So, so diet refers to the mothers?
No, multiple interventions,
Right.
Steve.
Yeah. Okay, so this is our HIV program. We are working to increase the amount of access to prophylactic PrEP services. We're working closely with many community organizations as well, and making sure that our community is being tested and screened for HIV and make sure that they're connected to care. During the pandemic, a lot of people fell off their medication. As you know, HIV is a disease that can be handled and taken care of, and people can live long lives, but some people have fallen off of care, and so we were trying to connect those people back to care, and by identifying and testing more regularly.
Does the mobile medical unit, does it exist? I thought, oh gosh, I thought, Julio, what's the name of the doctor who comes to us every December?
So that's oh my gosh, with this HIV program.
Yeah,
Who's that? Is that P. Gordon? or-
Gordon, Dr. Gordon.
Yeah.
Didn't he tell us that the mobile unit was something that that he wanted to have, but it wasn't
Yeah.
yet in place?
We're improvising. The bus is getting licensed, the Article 28 license from the state, and so we're working with my colleague there, Sandra Harris, and the university, using their dental van to do some of the work in the community. So although we don't have the HIV specific van, the university has been kind enough to work with us and allow us to use that to do some of this work.
Oh, okay, all right.
Yeah, and Steve, I just want to add to that with Dr. Gordon, he was also working collaboratively with the Corner Project, and they have
right.
a number of vans.
That's right.
Oh.
Yep. We work very closely with the Corner Project. Yeah. Then mental health first aid is another program that we've had a lot of success with, specifically working closely with our faith-based community. We have done over 20 trainings in 2021, more than 240 members trained. We also work with District 6 and several parent coordinators were trained in mental health first aid. We're offering mental health first aid training to a variety of community organizations. Our community health workers have been trained in mental health first aid as well. And this is a way to try to, identify mental health issues early, try to get them connected to services and care so that they don't become a crisis. These are some of the new programs that we're going to begin to put in place. One is our substance abuse treatment program. We're going to start an opioid overdose program as well. Embrace, which is a program using doulas, again, to work with moms post-delivery, so that these doulas will go into the home and work with moms. We're going to expand the Turn to Us program, and I think, Steve, you know about the Turn to program. It's a program that works in elementary schools, working to with children that show signs of potentially having behavioral health issues, and trying to address and prevent from escalation. The Health for Life program is a pediatric obesity program, trying to address the issue of obesity again in our community and trying to address those issues. Play Streets is a program that we worked with Cloth this last summer. We closed four streets in the community, and we will continue to do that and work with Cloth on Play Streets. It gives an opportunity for local, community youth to have a safe place where they can work, play and be able to stay physically active. Having, as you know, Steve, I grew up in this community, and knowing how important that is to have a place where you can go and in a safe environment and be able to play. And we also, work with local youth to make sure that they are then hired to work in those Play Streets as well. We're also going to expand.
Do you work with the PAL on that program? They used to have a very active Play Streets program.
Well, we work with Cloth. They have their, that's who we're working with right now. And our chalk program provides some of the actual physical activity, groups that at the Play Streets.
Right, so
we're going to do tobacco cessation. We're going to expand some of that work as well. I'm sure everyone who lives in the community has seen smoking going up again, and lots of places that are now selling all the paraphernalia of, buka and all the other things that, for smoking. So we're going to work with that. And then we're going to have a program on colorectal screenings as well, using navigators and, to make sure that we're testing and getting to the communities with those concerns. So that's my presentation. Happy to answer any questions.
yeah, well, yeah. Let me. Before I call on some of my committee members who have raised their hands, I just want to make two of my standard points. Well, my first one would be is that I would hope that this plan would incorporate the suggestions or as you know, we received a letter from Dr. Corwin a few years back when the issue about the psych unit at the Allen Hospital first came to the surface, and his response to us when we opposed the closing of that, when we first opposed the closing of that unit, was that the hospital's intention was to expand its outpatient programs in the mental health area. And he outlined 6 or 7, maybe 8 different programs, all of which sounded wonderful. Maybe the mental health first aid was one of them. I don't have the letter in front of me at the moment, but I would hope that this plan will take seriously what Dr. Corwin said the hospital wanted to do back then, and will actually will implement that whatever that 7-point program that he outlined to us and said the hospital had intentions of doing. So I would hope that what he told us the hospital wants to do is that will actually be incorporated into this plan and become reality. And on the question of the hospital's response to COVID, I sort of get very nervous when I hear the expression that we're in a post-COVID period. I mean, in just the last week, 129 of our residents in Washington Heights and Inwood came down with COVID. And since this committee last met a month ago, 9 residents of Washington Heights and Inwood died of COVID. So I don't know that we're in a post-COVID period. And I just looked again this afternoon at before I joined the meeting at our vaccination rates, and we're still running way behind the rest of the city. and really way behind the rest of Manhattan, by Dennis, on people who have had their first dose, on people who have completed the series, and on people who have gotten boosters. We're just way behind in every category. And I would really like to see the hospital, as I've made this point time and time again, initiate a much more aggressive program on trying to get out there and making sure that the residents of Washington Heights and Inwood, people who live in the shadow of this institution, I think it's really a sad situation when so many people who live right in the shadow of the institution are not being vaccinated and are not getting the word that they should be in order to protect them from the pandemic. Because the pandemic, as far as I'm concerned, has not gone away, and I don't know if it ever will. Please take that back. Those are two things I really want to see incorporated into this plan. OC, I call on you now.
Yeah, thanks. So we don't know how many people were surveyed in this study, and we don't know how many of them are residents of Inwood and Washington Heights. So, Steve, I just feel I'm not happy about that study because we don't know that info, and we also, I just want to say also that the median income is incorrect. It's much lower for Inwood and Washington Heights. It's not $52,000. So that has to be corrected, and probably other data. So I just feel that this is more like a general presentation that is not really specific to Inwood and Washington Heights. So I'm not sure that we can really address questions because we don't have all the information that related to us. And with that, Steve, I want to say that maybe going forward, when people are coming to present to us, should make sure that the presentation is related to us and us only, because we are Community Board 12 related to, and we have to address issues with Community Board 12. I mean, I wish everyone, good health and everything, but I just feel that I don't have specific information that is related to our neighborhood. And it's unfortunate.
Okay, let Andy respond to that.
We did take data that was out that was specifically for Washington Heights in Inwood. The data is will be publicly available. The analysis about 250 pages long. It was done by the New York Academy of Medicine, which is a very reputable organization, and not by the hospital. This is not data that we collected. Most of it is publicly available data. Everything will be available for you to look, but as we explained at the beginning, the CHNA is not complete yet. We're in the process of completing it, right? But Steve asked us to come before the completion. I would have preferred to come later in next year when everything is complete. The data will be available for you to look at and analyze, and
when the study is complete, and it's going to be related to Inwood, Washington Heights only. That's my question. We concerned about Inwood, Washington Heights.
Yes.
And this study is not.
I understand that, but the requirement that we have from the state and the federal government is to do an analysis of the areas that we service, which include Washington Heights, Inwood, but it also includes some of the.
But if I understand what you said earlier, Andy, there's a subset of the plan which is specifically geared to Washington Heights and Inwood.
That's correct. Yes.
And we still don't know how many of Inwood, Washington Heights residents were part of the study, and we don't know what is the total number of people that participate.
You will have that when we put it up. It'll be publicly available. You can look at it and read it, and you can see who the people were. It's an open book.
Right.
You guys can look at it.
All right. Well, so we'll probably invite you back when the study is completed. Yeah. Jay, your turn.
First of all, really, simple question. What do you regard as a community-based organization? And other than the four you mentioned, how many others were participants in this, and in what manner in Washington Heights and Inwood?
So community-based organizations are, can be a large community-based organization like Northern Manhattan Improvement Corporation or Cloth, or it can be a small CBO with just one or two people that are part of it. So, we've developed relationships with over 100 community organizations in Northern Manhattan. So, so it depends. There are some very large ones. There are some very large ones, and there's some that are really small.
And do these have names?
I just gave you some, so
You listed
Community League of Thai.
four in your report. I was
Community
asking for the names of some of the others.
League of Heights, Dominican Women Development Corporation, the Naval Avenue Y. Right now I'm thinking of other ones.
Jay, I think, it's across the board, includes, Fresh Youth Initiative as well.
Right.
So, I mean, it's, if you want specific names of all the organizations, I'm sure.
No, I wanted to
we'll be happy
get a
provide that.
clearer idea than the presentation provided of who was included in the discussion. And I think that was helpful, your intervention.
Thank you.
Okay, well, there's evidently a long list that will be appended to the
Fine.
plan.
Now, on a more philosophical plane, like OC, I'm a bit confused about the specifics to our area. And I was actually a little uncomfortable when I pointed out in passing that Marble Hill is the northern tip of Manhattan, and you quickly said, "Oh, we'll study Marble Hill too."
Well,
I don't know what to make of the presentation.
Well, Jay, let me just say also, I mean, community, I don't think Marble Hill is part of Community Board 12.
no.
It isn't.
Right, but it is something, as Andy mentioned, that we have a school-based health center, that's John F. Kennedy High School, and because of that as well, and the need, they will be part of this study, and the services.
So they're already part of the study. Is that correct?
Yes, they are part of this thing.
Okay. Okay, Catherine? Catherine is with us.
Yes, sorry, and I apologize for the background noise. Hi, Andy. It's good to see
Hi.
you on this
Hi, Catherine.
call.
Yeah.
I just wanted a quick clarifying question around the doula program. Is that part of the NYC initiative? And whether it is or not, I think it'd be great if once the program's underground for folks to come back and speak about it, because it's such an important program and it's really great to see that it's underway.
Yeah, we're working closely, Kathy, with Northern Manhattan Perinatal Partnership. They have a pretty extensive doula program, and that's who we're working with on this program, hiring doulas that are from the community, who work in the community-based organizations, and then connecting them to patients that need doula services. So I'll be happy to connect with you if you're interested to understand more, and we can have them come and present for sure.
I appreciate that. Thank you.
Yeah, didn't we have a doula program in the past up at the Allen?
So we've had a doula program now for a couple of years. Yeah, it was a small program, and because of the findings of we felt that we needed to expand upon that program, and we're going to be expanding that program.
All right. So that's one of the goals enunciated in this plan,
That's right.
That you would be expanding the doula program.
That's correct. Yes.
Okay. All right.
I actually wanted to ask a quick question about the income listed in as the mean for the neighborhood. Does that come from the AMI?
It
Well-
comes from, I don't know the specific source. It comes from publicly available data. I can check with NIAM and see where they got that data from.
The reason I was specifically asking is the AMI included in housing includes the area of Upper Manhattan and Westchester, and would be much higher than the incomes for community district alone. And that might be the reason that OC was questioning the total figure. It seemed a little high to me also.
Okay, well, we'll certainly look at that and make sure that it's accurate.
All right. All right. So you'll get back to us on that one?
Absolutely, of course.
Okay. All right. Are there any other questions?
Tanya was put it out and now she just logged in, but as a,
Tanya.
Yeah,
can you
I'm
operate-
as an attendee. I don't know how that happened. And it
No.
happened during this meeting and I don't know what happened.
Okay, well, you seem to be back.
I'm not. I have only webinar ability.
Well, you're showing up on my screen as one of the panelists.
I'm not.
Well, you can still speak.
Yeah, but I want that corrected.
You're still in the same side. Nobody switched anything.
It did because I'm looking. I know what the webinar looks like from being in other meetings.
I think what you mean is the co-hosting abilities, and that was my
No.
mistake.
No, I can't. I
There's
don't
nothing
have panelists. I don't have panelist screen. I know what a panelist screen looks like. I do
Yeah,
not have a
Paola,
panelist
she's an
screen.
attendee.
Well, you're showing up on my screen as a panelist.
I know that. I'm saying on my, I know the panelist screen looks different from the attendee screen.
She's attendee on my screen. With,
Can we get, okay, now I'm back. Can we, I don't know what happened there, but it's really like, seriously. But I had a comment from about the presentation. And I just had a couple of questions about the mental health portion. And what do you think are some links to the community environmental in the community? And the reason I ask that is because in Washington Heights and Inwood, there's a lot of chaos in the street. And there's just a lot of chaos. There's a lot of, again, if Steve knows, is my thing, the excessive noise and other things that go on. And it's just a lot happening. And there's not a moment, and there's been links to mental health issues from that sort of environment in the community. We have people, no one gets a chance, no one sits down and has a moment of silence, a moment to think. Like young people can't think because they're constantly bombarded by all this chaos. People who are working can't come home to like peaceful environments because they come home, they're in stress during whenever they're working, whether they're working from home or they're in an office, whatever the situation, and there's not a lot of peace. And has there been anything said? I don't know. I wasn't part of any focus group, but so I don't know if that came up, or do you know if that came up, or is there I would highly, recommend really looking at the links between that and some of the mental health issues, because that kind of thing really contributes to anxiety, depression. I've had people contact me about PTSD, people who already have PTSD being exacerbated by the conditions in the community. And so, and also the connection between not getting sufficient sleep and all of these excessive situations in the link to adverse physical health conditions.
Mhm.
So, I'm just curious of whether that came up. And I wanted to find out, who were some of the stakeholders that you all spoke to as part of this study assessment.
So I can share again, Steve, who all the stakeholders are. I can, I bring be able to share with you guys everything that we've done as far as who the people that we've spoken to, who are the community organizations that we met with. I'm happy to share that. It's all publicly available. I will share that with you once the report is complete.
But what about, but Tanya's
I just want to add a little bit, Steve, to Tanya's point. Tanya, it sounds that you're right. You're talking a lot around the social determinants of health, and really also mental health, which are, public safety issue, noise, street cleaning, safety, and all of these things. And I think that is one of the things that we're also doing when we talk about these partners, right? How can we partner with community organizations to also begin to look and help those organizations whose main focus is addressing some of those social determinants of health, the food insecurity. And also, let's not kid ourselves, our community was severely impacted from the COVID pandemic. So there's a lot of trauma, there's a lot of things that we still need to do as a community to continue to work collaboratively with all of our partners to address those issues.
But Andy, could you respond to what Tanya's basic point, though, about the stress that's caused by all the chaos and noise in the streets and the sleeplessness, and how does that get factored into your study or your plan?
Well, if I think one of the slides it talked about that specifically, about that from a community perspective. I think it said violence was one of the things that they identified as a street cleanliness. Was another area that they that was addressed. Teenage idleness is another area that kids not being able to have a place to go and something to do. So all those things, as Sandra was saying, are social determinants of health.
Yeah, but
I mean noise, like excessive, like it's more than
noise. As far as I can remember, did not come up on something that people mentioned. I mean, but I can go back and look. But I don't believe noise was one of those things.
Yeah, that's really
but definitely
interesting.
Definitely the other things you mentioned, like the dirty streets. I walk through Washington Heights every day. I take a walk around Washington Heights, and I see it as well. So, Tanya, I totally.
But I wasn't talking about the street cleaning, and that's not what I was talking about. I'm saying I get that part, but
that's what the people are talking about, though.
Yeah, that's why I was curious about who you spoke to, because people talk about it all the time. Like, this is a major factor in what some of the things that people are just talking about.
Is that noise?
Yes, okay. Yes, in this community.
Noise pollution.
Noise pollution.
It's a big one.
And also the links to mental and adverse mental and physical health conditions. So that's why I was curious of who was, you spoke with, because I find it hard to believe that never came up with any single person, because of all the complaints that we hear and all the discussions that happen on social media and all of the different groups that are dedicated to that particular topic. And it's just, it's to me, it's just a little strange, but, and I think that what I would behoove you all to do is really, make sure you don't, leave out that as part of your discussion, because it is a part of, it does, I can speak for myself. I was so stressed out that I just leave my house and I go somewhere else. Because I actually need to go to sleep. I actually need to do things, and it was adversely affecting my mental and my physical health, and also my financial ability to do what I needed to do. And I wasn't I'm definitely not the only one. So I just you know, I'm just trying to get an understanding. And I just saying that I would like that to be something that you all include, and perhaps maybe, you know, before you put out this final report, you go back and you actually talk to people in the community who have been seriously concerned with this particular issue and seeing the links. We work, for example, I have a task force about this, obviously, you know, some people know, some people don't, that's locally based about Washington Heights Inwood, but I also co-founded a citywide coalition that's concerned with all of the areas, including the areas that's mentioned in your study. People from all those areas are part of that group. So, you know, I would say, you know, really look at, look into who you spoke to, and look at, we work with, for example, Dr. Arlene Bronzaft, who's you all probably, some of you probably know, she's an environmental psychologist, and she's done a lot of work in this area, including a famous study in Washington Heights about the impact of noise on the children's ability to learn. So I don't know. I guess it doesn't seem like I'm reaching you all, but I would ask you all to maybe think about this and think about ways to look at these links, and maybe go back and rethink some of the people that you may have spoken to, and maybe figure out how to reach some of those other people who are concerned about this problem, because there are tons of them. Yeah.
Steve, so I'm sorry if you feel that you're not reaching me. You're definitely, I hear you, and we'll definitely go back and make sure that I look through the data that I see that, to make sure that we didn't miss that. So Steve, you were part of one of the focus groups. Did noise come up on in your focus group?
Well, I don't remember right now, but I tell you, I know that we discussed stress and anxiety and mental health issues. And as far as I'm concerned, they're all wrapped together. And when we talk about where some of these mental health issues come from, they come from what Tanya just described. Why are people so stressed out or anxious when they can't sleep at night, or when they hear firecrackers going off every single night for weeks on end, or when they hear cars screeching around the neighborhood, and other stuff going
on. Bullets.
Yeah, bullets too.
Yeah.
But sometimes you can't tell the bullets from the firecrackers. But to me, it's all connected. I think Tanya raises a legitimate issue.
Okay, thank you.
And I think that's one reason why there's such a strong focus on mental health in our community. I don't think I think this is one of the reasons. It's not
the mental health did come up.
I think it's not just coincidental.
Mental health is definitely probably the number one.
Okay, but I think under that topic, you'd have to include the stuff that Tanya has just spoken about.
Yeah. Okay.
All right. Well, I think we had a fairly good discussion, and Andy, we're looking forward to seeing how you incorporate our comments, and the report is to be completed by the end of the year. Is that correct?
That's correct.
All right. So maybe we'll bring you back in January, and you can tell us how it all turned out.
Okay. Happy to do that, Steve.
All right. I appreciate all of your good work, Andy.
Yeah. So Steve, before Andy logs off, I know you expressed some interest in learning more about the work that the ACN is doing around the asylum seekers.
Oh yes, yes.
So Andy, I'm not sure if you're still there.
Yeah, I'm here.
Okay, and so he could give you a little bit more detail on that work in collaboration with Columbia, that we're doing, and especially with Holyrood Church. So
yeah, we've had 2 events in Holyrood Church. The last one was last Friday, I believe, working with Holyrood and the DWDC La Sala, and provided health screenings, vaccines for children, COVID shots, and flu vaccines to adults. Referred different, a variety of issues that came up. There was a woman that was pregnant that needed care, that had not received prenatal care. So we connected her to our family planning clinic, received same day services there, and then connected her to ongoing prenatal care. Some of them had, issues with their feet, a lot of orthopedic issues that were addressed and referred to services at the hospital.
Well,
We saw about 80 the first day, and I think another 60 the second day. And we will have a third event coming up soon as well, to make sure that we continue to look at the needs of that community. We also did a drive to make sure that we got clothes and food and some items that they had requested. We're working closely with the mutual aid in the South Bronx, who is our connector to the migrants, and providing a lot of needs for that community. I had the opportunity to speak to some of them, and it was my heart goes out to them, and the needs are great, and I'm happy that we're able to help those patients.
So these are not people, well, maybe I'm, correct me if I'm wrong, these are not people who are necessarily living in our community right now. I know that I understand there are some asylum seekers staying at that small hotel on 181st Street, but
the majority of them are from there, Steve.
Oh, they are.
Yeah, but some are coming from other parts of the city. But we did work with them specifically. Some are going to local schools, so we wanted to make sure the kids got the immunizations they needed in order to be able to attend school.
All right.
And so we're working with them, but we're not just working with them. Basically, we're, if people need help, we're offering those services to them.
All right, very good. And but most of them are coming from that hotel.
Yeah,
Okay.
good percentage of them are.
Okay. All right.
Yeah.
All right. Well, thank you for that.
Yeah.
Sally, you have a question?
Yeah, didn't they decide today to shut down the Orchard Beach thing and move it to Randall's Island? Still
Yes.
a flood zone.
A few days ago, yes.
Okay.
It's in construction. It's not open yet. It's not being used. But in our own community, we now have, could it be 100 or more of migrants who are now living within our community on 181st Street?
Yeah, mostly from Venezuela, but some from other parts of Latin America, but the majority from Venezuela. And many of these people walk to, all the way from Venezuela. It's really, it's really interesting to hear their story.
Well,
So these people are asylum seekers as opposed to immigrants, right?
Right. These are legally, they've been admitted legally. They're seeking asylum here in the U.S.
Well, I think that you could still call them immigrants.
Oh, yeah, of course. I'm an immigrant. I came here as an immigrant. So yeah, of course.
I think it's an important distinction.
Well,
to describe these people as asylum seekers.
Well, yeah, but I think
various legal reasons.
Well, yeah, but they are legal immigrants.
Right.
That's the distinction. They are legal immigrants, despite what some people may think. All right, thank you, Andy.
Yeah, my pleasure, and thank you again for the opportunity to present. Take care. Bye-bye.
All right, take it easy.
Thank you, Andy.
We'll see you in a few months.
Okay.
All right, very good. All right, next up. Next up is our report from Pauline Ferranti from the Department of Health and Mental Hygiene.
Hi, good evening, everyone. It's Pauline from the Department of Health. So as follow-up to some of the questions from last month, I wanted to clarify, first of all, that I mentioned religious exemptions for schools, and that actually was done away with in 2019. So currently for all DOE schools, the only vaccine exemption you can get is a medical exemption. All of that information is on the DOE's website. Actually, if I can screen share, let me try. I'm not sure if I can, but I'm going to try and screen share so you can see what the website looks like for the DOE. And then also, so here it has the requirements. If you press on English, it's in multiple languages, which is very good. We want every parent to be able to have this information. Sorry, I'm trying to click on my various tabs. Can I move this bar? Sorry, I am not good at technology. Okay, there we go. Is that in the way of everyone seeing things? Okay. So as you can see, every information is in the top spoken languages translated for parents to be able to see. And then here it clearly states what the exemptions are. So the form is only available in English for some reason. I guess it's to be able to be processed on our end, you know, to be processed accurately. So that's the reason why that information is probably only in English. But you know, there was a backpack letter that went home about the polio vaccine. We are trying to make sure every student is up to date. Again, if you do not have the required vaccinations, you are not able to enter into the school and participate in the school year. So all of this information is on the DOE website. And here are the list of the vaccines that are required for all school age children. So just wanted to share that information with everyone. So it's really clear what the city requires in terms of vaccinations for school age children. And then the larger conversation about, is it okay if I stop share, or do you want this to be up still?
No, you don't, I don't think you need to do that.
Okay, great. So, and then moving on to the conversation about vaccine equity, I brought this up again to our Office of Health Equity. And, you know, government is a very slow moving vehicle, or a slow moving entity. And so when, you know, changes are desired, it still takes a very long time for the mechanisms to sort of follow through with that. And I know it sounds like an excuse, but, you know, we have to look at all city data as a whole. And unfortunately, Manhattan, you know, if you look at Manhattan as a whole, right, like vaccination rates were pretty good in terms of COVID-19 vaccinations, but then when you break it down into neighborhood, that is drastically different. And I think, you know, the Office of Health Equity was doing everything they could to sort of address those inequities and those the gaps. And the problem is infrastructure. The problem with the COVID vaccine was the limited nature of it in the beginning. There were so many things stacked against, you know, the city being able to fully implement, you know, equity into the vaccine plan, even though it was something strongly desired, and that it was something that we worked very hard to do. And I think also the other thing about Manhattan, which also doesn't necessarily apply to Washington Heights and Inwood, is the availability of transportation to get to a vaccine site. I think all of these things were taken into consideration. And, you know, not to say that neighborhoods should just be lumped in with their borough, but you know, in the grand scheme of things, how the city has to measure things, it's sort of other boroughs and other neighborhoods really were like much more underserved and like in need of like desperate, you know, pop-up locations and like really really focused, targeted outreach and that type of resource, being directed there. So, but that's not to say that that the city and that the health department did not think that CB12 was one of those neighborhoods. It was just, again, going back to logistics and what was available. And then also, trying to like lessen the red tape for like other providers to be able to provide the vaccine, so that it wasn't just, city run sites, but that you were covered through other means. And so I think that was sort of the way that the agency had to look at COVID response as a whole and citywide.
Yeah, but
And then
Paulie,
in terms, yes.
Paulie, let me just point out that if you look at zip code 34, 10034, which is Inwood, I mean, in Manhattan, the percentage of people, I don't understand how this works because we're not doing so well up in our neck of the woods, but overall Manhattan somehow has a 99% vaccination rate for people who have had at least one dose. And Inwood is down at below 77%, more than 22 points below that. I mean, that's a pretty drastic variance. And with people who have completed the dosage requirements, Inwood has 71%. The rest of Manhattan is at 85. So they're 14% below. On boosters, Manhattan is at 51%. Inwood is only at 34. So you're at 17 points below the rest of Manhattan. There's really a pretty sharp difference here between parts of our community and the rest of Manhattan and the rest of the city.
Yeah, no, I mean, and they acknowledge that, right? Like the Office of Health Equity acknowledges that. I think, again, going just back to the fact of, infrastructure and what was available, but then also I think so you had the question about 600 West 168th Street and why we stopped providing COVID vaccines there. It was because there was like not good uptake of vaccine in that particular location. And so, the city did its best in like pumping information and encouraging vaccinations and getting people to, trying and encourage people as best as we could. I think you could beg to differ, but, we did our best in terms of messaging and targeting messaging to certain neighborhoods and, ads and having lots of focus groups as well, like trying to figure out what was the best way to get this information into people's, minds that they should get this vaccine. And it just, there wasn't a lot of people going there to get the COVID vaccine. So logistically and capacity wise, like they just decided that it wasn't a good, it just wasn't a good location because it didn't seem like people were going there. And so that's the reason why they shut down the COVID vaccine operation at that location. And then in terms of MPV, monkeypox virus,
right.
And the vaccine, it was due to limited availability, but then also really targeting, like making sure people knew exactly where to go. And so there were very specific targeted sites so that people didn't have to, like, it wasn't something where people would be confused as to where they could go. There were very specific locations where they were being offered. Now there are 30,000 more doses being offered starting today. And, per the last 7 days, I think according to our data, only 3 new cases of MPV. So we're seeing the trend go in the right direction. But again, the point is not lost. I've made it very clear. And the Office of Health Equity also, absolutely understands this. I think it's just, again, not to make excuses for government, but like everything just works a little bit slower. And, working with existing infrastructure is always the most efficient way for a city to do things and to get, resources to a location. And so obviously that's going to be discussed as we move forward, what infrastructure can be built to support resources being sent to or being provided or being housed in Washington Heights and Woods moving forward, so that we don't see the same type of disparity and inequity hopefully in the next pandemic, which hopefully will not come for another 100 years. But this is definitely something that the agency takes seriously, and it's something that we want to improve on. And so your partnership would be really valuable, of course, and just suggestions and everything. So I don't believe we're going to have any like mobile vans at this point for COVID vaccine. I that was under, so again, and then also with like the confusion and bureaucracy with like between us and H&H, all of that, like, I don't know whether or not they have the capacity, so I can definitely find out. And we do not have plans to do mobile vaccines for MPV. So those are the biggest updates. Hopefully they answered your questions. I know maybe not to your liking, and I apologize for that, but again, the city has to deal with like citywide data, and we're working on trying to narrow it down and really be neighborhood specific as opposed to borough specific, because this goes across all lines, right? When we talk about medium household income, like this all is something that we need to be much more targeted and focused and really adapting to each neighborhood, because every neighborhood is very different.
Let me, did I hear you say a little while ago that there have only been 3 monkeypox cases?
Per our website, in the last 7 days, there have been only 3 new cases.
Right.
So it looks as though everything is trending in the right direction. And then as of the 3rd, there were no cases detected on that day. And the website, of course, is not yet updated for today, but it's good news. But again, I think information, education, targeted outreach, all of those things need to work in tandem. But your point and the community board's point about access to vaccines is something that the agency does take very seriously.
All right. Well, I think this will be a continuing discussion, because I keep looking at these figures that I take down from your website about the the percentages of people in our community who are vaccinated compared to the rest of the city and Manhattan as a whole, and we just continue to be lagging way behind. But I'm sorry, one more time though, the 3 monkeypox cases, that's 3 total citywide?
Yes, per citywide data, in the last 7-day average,
Okay.
there were only 3 new cases detected.
All right, because I tell you, when I saw in Andy's presentation that I believe what I saw was that the number of HIV cases in Washington Heights and Inwood were significantly higher than Manhattan overall, I believe it was. That makes me think that that we could still have a monkeypox problem. But it's good to hear that it's that there were only 3 new cases for the last 7 days and no new cases at all on Monday, October the 3rd.
Right.
Very good. Sally, you have a question, and then we turn to
Yeah, but we don't know for a fact that the no new cases or the 3 new cases is the extent of what's out there. One of the things that I keep hearing is how difficult it is to navigate the monkeypox system, both in terms of getting diagnosed as well as getting treatment once you are diagnosed.
Well,
So,
I believe that once you go to a doctor, doesn't Pauline, could correct me if I'm wrong, don't the doctors, aren't they required to report the cases to you?
Yes, that is correct. It's reportable to the health department.
Yeah. I mean, so yeah. I mean, I assume those are accurate figures. OC, your turn.
Yeah, I have it's a follow-up for a question I had last month about the right of parents to know if there is an unvaccinated kid in the class. And there was some various opinion. Yes, they should. I mean, I think some said that they don't have the right to know. So I wonder if you found out if they do have the right to know if there is an unvaccinated kid in the class where they're sending their kids.
Right, OC. So I did not get a response to that. So I'm sorry about that.
That's okay.
Let me follow up again. Actually, I'm gonna send an email right now as a follow-up to our school health team about that question.
All right, OC, to clarify this, you're not asking for the name of that unvaccinated
No,
child?
Right. It's just like if someone in the class has a peanut allergy, to be
Right.
like, let's not bring peanuts or nut snacks because someone in the class has an allergy. I think that's sort of like the basis of the question. I
Right.
just don't know whether or not it's taken the same way in terms of, an allergy versus a vaccination status. So OC, I apologize that I did not get that information, and I will bump it up right now.
okay, thank you.
Okay, we trust that you will get the answer. All right, any other questions for Pauline? All right, there are no more perils for Pauline. Very good. And nobody liked my joke. Okay, we move on now.
I chuckled, but I was on mute.
Oh, yeah, oh, very good. Well, next time, please unmute yourself if you're going to chuckle at one of my jokes. Okay. Julio Batista giving the regular report from New York Presbyterian.
Hi, Steve, and my apologies for being off camera. I just finished a little while ago with Isidro Medina and the bid. We're relocating our office, so we have some office furniture, and we would so parcel it out to different community groups that need furniture. So we're just finishing off taking out some desks and file cabinets and so forth. So my apologies.
Are you still located in the hospital?
So we're the Office of Community Affairs is moving to 21 Audubon on the second floor. So as you know, that we have a clinic at 21 Audubon on the corner of 166th Street. Right. There's a separate entrance to the left of the main entrance to the clinic, and that takes you up to the upper floors. So we're actually on the technically it's a third, but it's designated as a second floor.
So you might actually be able to wave to Ebenezer across the street in his office.
Yeah, I could. Yeah, I probably could.
Okay. All right.
And
So
that means we can have coffee every once in a while now too.
all right. So that's the entire Office of Government and Community Affairs?
That's the Office of Government and Community Affairs for the Columbia campus.
Right. Okay.
Correct.
Very good.
Yeah.
Okay. Well,
So-
okay. With that, now for your report.
Yeah, so I'll be very brief. I mean, there's actually following sort of the steps of someone who I care very much for. There are 3 points, but the third point I'll probably leave for Sandra to elaborate on. But excuse me. So I just want to sort of follow the report of Andy with the asylum/immigrant seekers that, as you know, also prior to what's going on, is that Dominican Republic, Puerto Rico was hit very bad by Hurricane Fiona. One of the things that the hospital did, and actually tomorrow is the final day, is they've collected items that could be shipped. So we set up bins at the lobbies of the Milstein, the Allen Hospital, and the Morgan Stanley Children's Hospital. And we also worked with AmeriCare to set up an account for anyone who wants to contribute any financial support for the relief effort of those that were affected by Fiona a few weeks ago. The other thing I'd like to just report is in our last time, I think, came before the committee, we did mention that later this month we will have a flu shot event that was going to be taking place at Hebrew Tabernacle. Unfortunately, we have to push that from this month to November 1st from 10 a.m. to 1 p.m. at Hebrew Tabernacle. And we're partnering with them and the elected officials and the community board to help get the word out that we will be providing their flu shots for community members. And again, that's November 1st. There is a flyer being developed, and once that is done, I will share that with the committee and hope that the committee members will also please share that with the community. And then finally is on the, something that I know the attack community has been holding, the breath, bated breath to get some information on is really the Medical Center Neighborhood Fund. And so the letters are going to be going out. I believe Sandra will collaborate on this, who's a partner in the fund. And, the steering committee has met and finally has made recommendations in terms of supporting the groups. We had, I believe, 55 organizations applied. A majority of them, of course, for the exception of one or two, because of different reasons, were not. But everyone else will be seeing some support. There is an event taking place in November at I understand, a beautiful location at the the new nursing building, and we'll make sure that this will be the first in-person event the fund will have, and I guess this will be the third year. So we'll make sure that this committee and members of the committee receive the invitation to join us at the award ceremony when it happens in November. And that's it for now.
Do we still have COVID cases in the hospital?
Oh, Steve, my apologies. I've neglected to get the numbers just because of this move and just trying to get the word out about getting the donating these furniture. I would we do have numbers, but I don't have them at hand with me now. But I'll try to share that with you.
All right, I would appreciate it. And let me just make a pitch, as I did in my email to you. I would hope that the hospital could do similar flu shot events elsewhere in the community, certainly more than just one, and that we would be able to cover different parts of the community. 1 second, we have.
And I just like to say that the reason why we had to move the October Hebrew Tabernacle flu shot event is because we're again having events supporting the asylum seekers, at which point we also provide the flu shot to participants as well.
But I think I heard Andy say that you're also giving them the COVID shots, no?
They're I believe it's to maybe the students. We do have, well, as a matter of fact, and thank you for raising that, Steve. One of the things that we also want to ask of the committee is that as we do these events, we've encountered, we have a van that goes back and forth with supplies. And, on occasion, we've had to transport folks to the hospital. So we'd like to perhaps get your support in trying to see when we have this event that we can get some support from the precinct so that there'll be access for the van to be able to, pull in and be able to have a place where they could, be able to drop off and pick up samples.
So I don't know. So where would that be?
So that would be at the Holy Rood Church.
Oh.
Most likely, it would be right in front of the church on Fort Wash, so that would make it much easier to be able to navigate.
And have you asked for that courtesy from the precinct?
So we what happens with these is, of course, that these things, unless you get a permit, it's not really enforceable because of the time frame. It becomes difficult. But they've been supportive in terms of giving us, providing signage. But we just want to make sure that courtesy continues.
All right. Well, I would certainly hope that Paola, could you mention that to Ebenezer? Maybe Ebenezer could also put in a word with the precinct. Okay, Jay, you have a question?
Yeah, I guess you don't have the information, but last month I asked you to find out if records are kept of people who came into the hospital without COVID and who caught it in the hospital. And you said you'd check on that.
I'm sorry, Jack, can you repeat that again? I'm sorry.
Yeah, sure. Last month, I asked you if the hospital kept a record of people who were COVID-free and caught COVID while in the hospital. And last month, you said you try and check on it. I was just wondering if you had any such information. I guess you were busy, you couldn't check this
Yeah,
month.
these are the numbers, my apologies. These are the numbers of folks that are in the hospital who contracted COVID while they were in the hospital.
Yes.
Okay. Yeah. Yeah. All right. So when I give Steve, I mean, the report that I usually get does have sort of the numbers of inpatients and patients that have COVID. So I'll figure out what the because it usually is a 50-50. So I'll get you the exact number.
No, I understand you do a good job of testing people before they're admitted and finding out if they have COVID and didn't know it. What I'm asking you is a totally separate question from that.
Mhm.
Jay is asking whether after patients are admitted to the hospital, they do not have COVID, but while they're in the hospital, they contract it. Somehow they catch it from other patients, if that happens.
So I see what you mean. Okay. All right. Well, let me find out. Apologies. Let me circle back and see if we have the data. So these are patients that came in, were fine, but then as a result of their admission, caught the disease.
Yes.
Correct. Okay, I got you.
Yeah, that's his question.
All right, so I'll get that for you.
Okay, very good. Sally.
Yeah, I think I get a no to the first question, which is any update on Alan. The concern that I have, I guess, is that all the buzz right now happens to be around outpatient services and telehealth, which this isn't relevant for the Allen population, but certainly for youth and adolescents. Those appointments are not helpful for children. And so I'm wondering how we're going to address the crisis in mental health care. And I guess there was one number I'd asked you for, which is an estimate of the time and the expense of converting a psych bed, a med surg bed back to psych. What would it cost you to put Alan back to rights?
So the first question on the Allen psych bed, there's nothing new to report on that. Now, in terms of converting the that unit back, I don't have that number, but it is in the upwards of probably $10 million. But I'll find out because there was a significant multi-million-dollar cost to be able to change that from a psych unit to a med surg. So I assume that the sticker price will probably be around the same. But I'll see whether facilities has some sort of estimation.
Thank you.
But I'm not, and I'll see whether that's a possibility of getting that.
And then telehealth for children, a concept yet to be proven effective.
Yeah, I mean, I cannot say speak to how effective it is or it isn't. I mean, I'll be happy to bring to this committee someone that can speak about telehealth.
That would be great.
And adolescent and what's the experience has been with the youth population, and could probably speak about the effectiveness of those sessions.
Great, thank you.
All right, that's it for our questions. Thank you, Julio. Next up, Sandra Harris. representing the Columbia University Irving Medical Center.
And NYP. No, I'm just kidding.
Oh, hey.
Yeah, so I guess I send you the report, or Janelle sent the report, Steve. So I will highlight
Yes.
some of the points in the report, and I think to follow up on Julio's with the neighborhood fund, the award ceremony is going to take place November 15th, and we have awarded close to $200,000 in this round of awards. So we're very happy. And looking forward to seeing all of you there, if you can join us for the celebration.
Isn't that more than usual?
It is. It is more than usual. One of the things that we did as a result of COVID is really encourage, particularly the organizations working on food insecurity, to really go full blown with the application in terms of request. So we have funded a lot of groups at the highest level, particularly the groups that were looking at these special needs category. As with many CBOs, the city and institutions, many groups also have been challenged in terms of incorporating virtual and in-presence, environment and providing services. So the needs are definitely greater, particularly with some of our after-school programs. And even our arts organization was something that our site visitors, for those of you that don't know, the way the program is run is that organizations submit their request for grant awards, but then we have employees who volunteer throughout the university, the hospital, and Psych Institute to actually serve as site visitors. So this year, I have to tell you, and Julio can back me, the site visitors were, sort of pouring out and really talking great things about what they saw when they visited the sites and when they spoke to the program coordinators. So the need is definitely out there, and it's very palpable. So the committee did respond in a positive way to that need. In addition to the fact, I have to say that also the donations that have come in for the fund have increased. As many of you know, the fund is is operated with volunteer contributions from employees of all three institutions. So I think also the employees have also donated more money than usual. So we were able to be much more generous or try to accommodate this program, because I would say that there's great need out there, and I'm sure they need a lot more money than what we're able to offer through the fund.
This doesn't operate like as a what is it called, like a payroll checkoff, or does it? Do the employees or staff have to send in separate checks, or can they tell you to deduct it from their pay?
There's three ways. They can have it as a payroll deduction, and that's the way I have my contribution. So we can do payroll deduction. Some people choose to do annual bonus, so they just write a check to the fund. So it's either or, but the majority, we have about 40% that's payroll contribution. And each year, we send them letters, they increase those contributions, and then the other comes in through our annual drives that we do internally.
And I should have asked this question maybe of Andy, but when we talk about groups that work on the food insecurity issue, I don't know that we have the ecumenical food pantry any longer at the Broadway Temple Methodist Church. Or am I correct about that?
No, the pantry is still there.
Oh, it is. Okay.
Yes, the pantry is still there. Okay. One of the things in terms of food insecurity that happened as a result of the pandemic is that we also have our larger organizations like NIMIC and Cloth, who are now addressing food insecurity issues. For example, Cloth recently has received some funding to just expand that program, and they actually are bringing in a kitchen and getting ready to do hot meals as well. A lot of the big jump on food insecurity has also been our churches and our faith-based organizations throughout the community. Three of them, including the Nego Y, also have hot meals. So it's also in addition to just providing the bags, the gift bags, they're also now cooking meals. And it's also a nice way with the food insecurity for us to link our employees and our students. So a lot of our students and employees also volunteer during food distribution days to help out. It's one way that they get to see some of these social determinants of health issues that our communities are facing as well. Okay, so on my report, I'm going to highlight 3 important programs. So I'm not sure if Janelle presented to you about our Seniors Aim High program. Seniors Aim High program is a collaborative partnership with the Armory, in which working with our AIM clinic at NYP, where we have identified seniors that would benefit from physical fitness activities and wellness education program. So initially, when we thought of the program, we said, oh, you know, we'll get 100 seniors, and everybody just rolled their eyes. We're not going to get 100 seniors to go to the Armory every Tuesday from 10 to 11. I'm happy to report that we're in our 8th week. This is a weekly program. Participation has been 99%. Okay, and have exceeded. We had space for 100 seniors. We have 167 seniors registered and attending the program each week. So we're really happy for this. This is a 45-week program. We're calling it a pilot program and hoping that we can do this every year. The seniors are already asking for 2 days. So we're going to start conversations with the Armory to expand the program to one more day.
And is it free of charge?
It's free of charge.
How could you leave that point out? Okay.
Oh, I'm sorry. Well, I assumed that it was, you know, everyone would get it free of charge. And the way we work the program is with incentives. So seniors get incentives for 2 visits, 3 visits. This is why the participation has been incredible. So the 4th visit, they got a tracker, a fitness tracker, and we teamed up with a group of students that help seniors with technology. So then we also have the students come in, they have a table, and they teach the seniors how to set the trackers, how to set milestones, etc. So very exciting. Then each on the 6th, 7th, and 8th week, we started the sneakers, and they do it in this creative way. So we actually have, it's like a raffle. So we have a roulette. So, you know, each Tuesday, 5 seniors walk away with their sneakers, there's jackets. So we're building up the momentum for them. So they're all very excited. But what I want to stress is, in spite of all these incentives, when you talk to them and when you hear them connecting, they really talk about bonding. I mean, Tanya, when you mentioned that point about noise and security, a lot of them said, we can't do it in the park because it's not safe. We're scared to be out there. So this is a safe space when we can connect, and they're connecting with one another. Now you see them waiting for each other, you know, as they're leaving. We sometimes host events for them at the plaza following the fitness program. So they're really have developed a special bond. So it's very interesting to see. I'm very excited and to see how many of them complete the 45-week program. So very great things to see. I just wanted to add also on the migrant work that Andy and Julio alluded, we're also connecting with our dental van, our medical and dental residents are also volunteering at Holyrood. Steve, in the report sheet that we sent you, there's a link to our GCA website where people can have information where to donate if you want to volunteer also with these groups. And this has been really a coalition of churches, community organizations, and others that have come together. So if anyone is interested in volunteering, the information, you can go to our Government and Community Affairs website, or just contact Holyrood Church. I believe volunteers drop off also for donations are Tuesdays and Fridays from 10 to 3 and 10 to 1 on those days.
I'm sorry, one more time. That Tuesdays and Fridays, what times?
Tuesdays 10 to 1 and Fridays 10 to 3.
All right.
It's on the report and on the link also.
Any chance there's a flyer about that?
Oh, I let me check with them, and that's why we put that information on our website.
Okay.
But definitely, but it's something that they announced during service, and it could be them, Cabrini Shrine, all of the churches are sort of coordinating one drive. And there's also a list of items that they're looking, especially with the children, a lot of children's clothes, hats, scarves, gloves, etc.
If there is a flyer, I would like to have the community board office send it out.
Okay, so I'll remind them of that. Okay, the other thing that I want to highlight is that we received a $10 million grant from Pfizer, and I don't know if again it was brought to this committee to increase underrepresented minorities, communities and populations participation in clinical trials. So I wanted to bring this here because this is a topic, Steve, that I've been working on, and I want to figure out how we can partner with the board and other community partners to begin to have those focus groups and those conversations about what are those challenges and barriers. We know about the history and research and the lack of trust, but one reality that hit us really hard was the fact that because of underrepresented minorities, low participation in research, a lot of these medications that were out there did not work for us. And when speaking directly to the COVID vaccine and some of the challenges that we face. So there is a focus and a recognition has always been there, but the fact that we need to act and really get information out to communities about clinical trials and how we can participate in a safe ways and really speaking about the benefits, the pros, the cons, but getting the information to the community. So this grant, part of the work that we're doing, and it's also working with Andy and his team, is working to work with community health workers at our various clinics, with community-based organizations, the clergy community, and really begin to have those conversations about the research and the research that is so important to save lives, but to make sure that we're also included in that research.
Well, you may recall that this committee some years ago, and for a number of years, was focused on this question about community participation in clinical trials.
Mm-hmm.
And a piece of that would be community participation on the institutional review boards that authorize the clinical trials.
Yes.
I mean, from our perspective, one way to get the message out and to build confidence in these clinical trials would be to know that they've been reviewed by people who have a community perspective and come from the community. And
Mm-hmm.
so I would like to take we haven't taken a look at this in a few years now, but I would like to take a look to see whether the memberships of the various boards, if I remember correctly, at Columbia, there are 5 different boards.
Yeah.
And I would like to take a look to see whether or not you've been able to expand that membership and to include more community representation.
Mm-hmm. So, yeah, and this is something that I would like to pick up with this committee and maybe bring a sort of a series of presentations on what has been done in that area.
Very
in
good.
terms of the review board, some of the challenges is getting community members to commit the time. I mean, a lot of them find the information daunting, etc. But there's a lot that we're doing in that area of creating community ambassadors and having the conversation at the table, because we need to figure out how do we build that trust and how do we educate community in that front. So
Okay,
very important.
Well, I definitely want to have a continuing conversation on that question.
Okay. So I will be coming back with that because we're creating something like that. Then I also want to highlight, and this is just an update, we recently participated in the Rally for Medical Research up in DC. This is a march, again, that we do each year to bring attention to the importance of research and science. So we'll have more updates on that. We also noted the our new dean. As many of you know, we have our new dean at the School of College of Physicians and Surgeons, as well as for our entire campus, Katrina Armstrong, and she last week made her first State of the School address. The reason why we're mentioning it is because one of the things that I believe some of the people that participated in our PME are aware of this is that we are now leading our peer institutions in medical students, underrepresented minority medical students. We went from 9% to a 31% increase, actually leading our peer institutions in that area. So one of the things that she emphasizes our commitment, not just of bringing underrepresented minority students, but also making sure that once they graduate, we keep them, because they're stalling pretty quickly once they're out there, and we want them to stay with us. So that's something that we want to continue to explore and improve.
So are you saying that 31% of the incoming class at PNS are
Yes. Yes.
are minorities?
Yes. Yes. And again, this has been possible because of the work of Dr. Hilda Hutchison, who is our chief diversity officer on campus. So she's well known around the country when she's out there looking for students. So she got us to this place, yes, and we hope to continue those efforts. Okay, and two announcements. Northern Manhattan Neighbors Appreciation Day is this coming Saturday. So far, last night I checked, and we have 500 local residents who have secured their tickets for the game. So I hope it will be a winning. We're playing Wagner, so hopefully it will be a winning day for us. And October 22nd, Manhattanville campus will be hosting Community Day. So this is a day, it's really about sciences, kids, and stem cells. This is the second year in a row that we're hosting this event. These two, Steve, we did send to the community board. I need to double check that the flyers actually went out and were distributed. Our Dykeman Scholars will be announced. I believe we're coming next month with those announcements, and hopefully we'll get some of the students also to join as well. And
very good.
That's about it.
Yeah, I think you ended up covering virtually everything on your.
I did. I was just looking at that, so I did great.
Yeah, you did a pretty good
Great
job.
report.
Pretty
Yay,
good job.
Sandra.
Thank you. So one of the things, Steve, I'll send the committee an outline of some of the research in clinical trials and some of the things that I want to cover, especially one, getting community residents to be part of committees, right? The research committee, the research ambassadors, and also to speak about something very innovative, it's not innovative, that both NYP and CIMC is working on, which is creating the Columbia University Biobank. And I will speak more about that and the benefits of having a biobank on campus for research and what this means for the community overall.
All right, very good. Any questions? Seeing none, we'll move on to our next report from the Isabella Geriatric Center from Diane Ashley.
Hi. Hi. Let's see if I can get this to work. Good evening, everyone. The part of the theme, I guess, has been vaccination. So I'll start with an update on that. 91% of our residents have received 2 vaccinations. 25% have received 3, and 54% have received their 4th vaccination. The CDC, as I believe you all know, has approved the new bivalent COVID vaccine. I hope I pronounced that correctly. That not only covers the past strains, but also new variants of COVID. We are now offering that new vaccine to residents, patients, and staff. And we are hosting, in addition to education, sending out communication to family about all of that. We are also, excuse me, hosting clinics for vaccination for staff weekly. And all staff are in compliance with DOH vaccination requirements. All visitors continue to be screened and COVID tested before they go to see their loved ones. We are seeing a significant increase in the number of visitors that are testing positive. We currently have 20 residents who tested positive and are in some phase of their state mandated temporary isolation. These residents are stable. And we are also offering education, encouragement to families, and to have their loved ones receive the flu vaccine. Again, we cannot administer either vaccine without either the resident giving agreement or their family members. In most cases, it's a family member. We are offering the flu vaccine, although guidance says that the flu vaccine and the COVID vaccine may be given together. We are giving them separately out of an abundance of caution, and so that we can track if there's any reaction on the part of a resident. So we are doing that separately. In our last meeting last month, I believe it was Jay who asked for some follow-up information about who surveyed Isabella as a result of the COVID activity. During the, sorry, I'm just looking at my notes because I want to get this right. Certainly during the height of the pandemic, because like you, Steve, I'm reluctant to say it's over, but certainly during the height of it, the Department of Health surveyed Isabella at least 6 times. We believe it's more, but in pulling the information together, I could quantify at least 6 for infection control. DOH is the regulatory body that oversees nursing home operations and quality of care. So they are the ones that we are beholden to. There were no major findings. We were also found to have reported accurately the many times our data was reviewed. And any recommendations that were made for DOH on opportunities for improvement were not only reviewed, but also implemented. There were also investigations from other bodies, such as the Attorney General's office, that do not regulate nursing homes, but obviously have a responsibility to protect the public, especially the vulnerable population that we care for. These investigations were all closed with no action taken. And I think that is my update. Yes, Jay. Oh, sorry, it's not my place to call on people. Sorry, Stephen.
Well, before I call on Jay, let me just make sure my notes are accurate. 91% of residents have had 2 vaccinations. 25% have had 3. What was the number for the?
54% have had their 4th vaccination.
Oh,
Obviously, there's some duplication in there.
Yeah. Okay. So it does go from 25 up to 54 when it comes to 4 vaccinations. All right. All right. That happens. Okay.
So it's 191. I'm sorry, I didn't even give the one. 91 for 2 vaccinations,
yes.
25 for 3, and 54. Yes.
Right. And you're finding a significant increase in the number of visitors who are testing positive. And at that point, I guess
they are delicately asked to go home and come back after being given guidance about how to.
Well, you're not letting them in the building at that point, right?
No, no.
You cannot do that. They have to be turned away.
Yes.
And you have currently, you say you have 20 residents
20 residents who have tested
Tested
positive
positive.
and are going through their
Isolation.
mandated isolation, yes.
Right.
And that's temporary, of course, they go back to their regular room.
Right, after, what is it, 5 or 10 days or?
I don't remember the exact, I don't think it's as low as 5.
Right.
Um,
But I think it
and-
was,
and-
it started out at 10. I think it might have been reduced.
I would have to
Okay.
check. That's not something that I know. I just know that we follow the DOH requirement to the letter.
Okay, Jay, it's up to you now.
I was wondering what exactly is the nature of the isolation that these positive patients have?
We have a separate unit or separate units set up that if we have people test positive, they can go to a separate unit so that they are not at risk of exposing other residents within the nursing home. So we actually have a defined space within Isabella that residents go to for this quarantine.
They're by themselves. They're by themselves.
There's a unit there. I don't know how the unit is exactly set up. It's set up per DOH requirements, but instead of being within the general population of the nursing home, they are in the quarantined unit. I don't want to misspeak and give you specifics that I do not know.
Okay.
I
You
certainly
think
could ask.
maybe
All I can tell you is we're surveyed and we follow the rules to be appropriate. Yes,
You
Jay?
think maybe next month you could come up with the exact information
Of course.
for us?
Sure.
And also, I had a sort of a question about, you mentioned that the Department of Health said you met all requirements and that also your reporting was accurate. But obviously the reporting is not accurate. That's what all the individual lawsuits against Isabella are about, to
Actually,
the best of my knowledge.
I'm
When
sorry.
I was just going to say, on one occasion, there was reported as 65 deaths when there were really 98 deaths.
So
The most egregious example, I don't know about others, but that's what my question is based on, is the fact that I don't draw great confidence from the certification by the DOH as to the accuracy of the reporting, if in fact the reporting of the major outbreak wasn't accurately reported.
Oh,
So
all right.
I'd like
So-
to address that
Yeah,
if
let
that's
Diane
possible.
answer.
Yeah. I'll try and do my best because I'm not an expert at this, but at the time, and I don't remember the specific time of the 65 and the 98, but there were multiple dimensions that were reported by Isabella, and we followed every single day what DOH requires. They require it by a certain time of day. It varied a little bit, but there were deaths at the nursing home. There were suspected. Remember, there wasn't testing for a long period of time. There were deaths in hospitals. There were suspected deaths in hospitals. There were points in time where we reported every bit of that to the state in whatever way the state was asking for it. And that does not mean that the state reported it out to the public in its full dimension. And as we learned later, I think when a lot of information came to light, the state was not necessarily, and I'm not saying DOH, but the state was not necessarily reporting back all of the different dimensions. We are beholden to report the Department of Health every day. We report those numbers every day, They literally go through and check when they come in for the audits, they come in and they check all of the data. And we told the truth. I do understand the frustration, Jay, no question. There was a point in time, I think I mentioned this before, it was literally over, I may have said it was over a couple of weeks last time. I think I was trying to be nice. I think it was over 3 days where we were asked to report the data differently by the state. We reported it every single time accurately. And so I do understand that there were public reports of different numbers, but if you dug into the numbers and looked, we would have reported the full number of deaths at the time.
Well, that's not exactly accurate. In terms of the reporting done by Isabella to this committee. In fact, when there were 98 deaths accurately reported to someone, Isabella reported to us that the number was 65 deaths.
I understand, and the reason
so that unless they had an ability to reanimate the dead, that was deliberately inaccurate information presented to us by your predecessor at Isabella.
So
when
the reason
by them and don't have any actual information to contradict the committee's memory.
So Jay, the only thing I will tell you is there was a point in time where the governor's office only wanted certain data reported. We reported that data set across the board when we reported to the public. We were being consistent with what the state was asking us to report. So rather than be inconsistent, and I understand that it created, in hindsight, it created a gap in those numbers, and we understand that. And frankly, we're frustrated because we told the truth, and in some measures, we're skewered for telling the truth. And I understand your frustration, but it was not us making a decision. It was us following what we were told we should report.
Well, just following the logic of that a little further, it's very convenient to blame it on the former governor who isn't in office anymore. But the basis for those inaccurate findings were the proposals put forward by the hospital and nursing home associations as to how the legislation should be passed on reporting.
I am not aware.
The hospital, as well as the nursing home, doing what the state wished. The state was doing what Isabella wished under the
That is not the case.
No,
That, to the best of my knowledge, that is absolutely not the case.
I think, Jay, you may, we need to look into this a little further. I think you may be confusing two different points about whether or not the institutions wanted to be held legally liable for deaths, as opposed to this reporting method, which is like something else.
I think you might be right.
Yeah, we did in no way lobbied for what data sets should or should not be reported.
I did have conversations with Betty about this stuff, and my memory is that she and Isabella felt as though they could not say anything different than what the state was publishing and distributing publicly. That they could not go beyond what the state was distributing to the public. So, I mean, there's certainly a certain amount of truth in what you're saying, Jay, but I don't know that I want to beat Isabella over the head about it, because they had to exist within a particular constrained situation, and they were being told only certain information was to be reported, and that's what they reported. I don't know that we can go back and undo what happened. All righty. Next, is Aretha Morgan still with us? Oh gosh, I think we lost her. Nicholas, do you want to speak on this topic? Nicholas, are you still with us? His name is on this list as a participant. All right, we may have to push this item off to the next meeting. This was to be an update on the contract negotiations between the New York State Nurses Association and New York Presbyterian Hospital. All right, next on the agenda is a discussion and a vote about our FY24 budget priorities. This is a list that I sent to everybody. Can somebody, I'm not too good at this. Can somebody post this on the screen? Does somebody have the list handy that I emailed to everyone? Well, okay, let's just go through it then, I guess. All right, so the first item on our list is to expand, we're going through the list from last year, the FY23 list. Number one, our number one, any way to make this larger? Who's doing this?
That's me. Yeah, let me, is that better?
This.
Wait, hold on.
It's getting good.
Is it good? Oh, yeah, let me see if I can.
Yeah, that's better. No.
Oh, that's better? Okay.
Yeah, that's no.
I'm trying to get it on the whole screen. Hold on. I think that's
it.
Try putting it landscape, would it? Yeah.
Oh, okay. Yeah. Good idea.
Try landscape. Yeah. There you go.
Yeah. Okay. There you go. Thank you. Okay.
Yeah.
Can you see the numbers? Okay. Yeah, we can. I always have to scroll up when you need me to scroll up because that's as big as I can get it. Yeah.
All right. So at some point, we're going to want to have the whole list on the screen at once. But this is
okay.
Okay. Thank you, Tanya.
Mm-hmm.
Okay. So number one on our list, expand mental health services in the community, especially for seniors and others whose mental health and social engagement have been adversely impacted from COVID-19. The response that we got back from the Department of Health and Mental Hygiene. Oh no, I'm sorry, I take it back. The response we got from OMB, presumably based on information that they received from the Department of Health, is that OMB supports the agency's position as follows. DOHMH funds a variety of services related to mental health, alcohol, drug abuse, and depression. We will review and assess the request for additional programming, which would be contingent upon available resources. Well, that's why we're asking for more resources. Our number two priority, number three for the board.
Can we comment before you go on?
Yeah, go ahead. Yes.
Okay, one is the word inpatient doesn't appear there. I wonder if it should. And second, it seems like with COVID and the school screw-ups, that the need for child and adolescent psychiatric services has skyrocketed. And I wonder if rather than just mentioning seniors, we should really mention students.
I agree with you. I do not want to limit this to inpatient. I would like to include the whole breadth of mental health services. We need outpatient services too. But All right, so after seniors, you want to add students?
Yeah.
Okay. But I assume we have a consensus on that point. Any other comments on number one?
Yeah,
Jay,
I do have a comment on the question of, does the 19% vacancy rate in the Department of Health mean that money already advocated has been freed up to be used for activities that we're promoting, including the increased funding for various projects?
well, I would look at it from a different angle. I would say that money that's been provided for in the budget can't be spent and services can't be provided because the staff doesn't exist to do the work.
Also true. But I just meant purely what happens to the money that was allocated and not spent? Can that be used to pay for these various health needs? Or does it automatically go into the general fund?
Well, well, I guess in a sense, it's the latter. The money, if it's not spent, gets basically rolled over into the next fiscal year. So it could be used as divvied up for any purpose that the city would see fit to do. Okay, can we any other comments on this one?
No.
Okay. So what number 2 on our list, number 3 on the board's list was to open a full-time vaccination site for COVID-19. At our last meeting, it was discussed that we should include monkeypox in Washington Heights with an annex or other regular presence in Inwood. Are there any comments on? Please address yourself as to whether or not we should keep these on the list or whether we should drop them.
Keep it.
And whether or not they should remain high up on the list or lower down, whatever.
They should stay high up on the list, in my view.
Okay, and I think I heard the same from Sally.
Yes.
Okay, any other comments? All right. So number 3, their response to us was that the approval of this request depends on sufficient federal and state funds. Next on our list, and number 6 on the board's list, was increase trash basket collection on commercial streets in District 12. Back then we said, well, this doesn't look like the right language. All right, so it looks like the language from the previous fiscal year was repeated, which was incorrect. All right, so our language here was with a second shift so that baskets are emptied more than once daily. And what we discussed at the last meeting was that we should add that this could be funded through the council's New York City Cleanup Initiative, as well as the executive budget. Are there any comments on this one?
I don't know. I just feel like maybe that's gonna end up dropping down. I mean, I don't know. It just depends on what. Yeah, I don't see it being number 3 at this point, but
Okay.
that's just my opinion. That's just my opinion.
Well, we are here to listen to your opinions. So,
Yeah.
are there any other opinions? Jay, is that a new hand? All right, well, let's move on. Number 4 on our list. Number 18 on the board's list was to increase services to prevent and treat chronic diseases such as Alzheimer's, diabetes, cancer, heart disease, and hypertension, conditions that increase susceptibility to COVID-19 in our community. And the response is OMB supports the agency's position as follows. More information is needed from the community board before making a funding decision. the community board should contact the agency. Well, I'm not sure what they expect from us, but perfectly willing to contact the agency. We could always talk to Pauline about it.
Well, Steve, I think, again, I don't know, but I think just what we heard today with the community assessment report is helpful. Because it shows that, some of those issues being prevalent in our community and why they matter. So I don't know, I guess think that we do have some data, some things that can be used to sort of solidify the point that that's important.
All right, so you would keep it on the list and keep it roughly in its current position?
Yeah, I think these things are very, very important in this community. These are things that people,
Right.
especially communities like this, that they deal with much more in higher rates than other communities, So I think it is definitely important. I think, there's data to show that.
Okay. All right, number 5 on our list, number 12 on the board's list.
Steve, I actually had an addition to number 4.
Okay,
I think you should add long COVID.
well, I don't consider that to be an objection.
Yeah, very good observation, yeah. Mhm.
Considering the high prevalence of COVID-19 and the low inoculation rate, there's a much better chance of having long COVID in an area like this than in other areas in Manhattan.
All right, point well taken. I believe we have a consensus on that one as well. Next on our list, number 5, number 12 on the board's list was to increase staff to
I
conduct.
had a point, Steve, I'm sorry.
What's
My
that?
mute, I had a point, my mute was on.
Are you back?
On the last one,
Okay. Go ahead.
This could include pilot programs for selected chronic diseases, perhaps in partnership with other community boards experiencing similarly high rates of chronic disease.
All right, well, that's sort of more detail than we can fit into the amount of space that they give us. But why don't we have a discussion with Pauline about that in our next meeting? That
would be great.
That's an interesting idea we should try to pursue.
Yep.
Are you okay with that?
Yes.
Okay, very good. All right. We're back to number 5. Increase staff to conduct regular noise enforcement, especially nighttime, air quality monitoring and water quality testing in our community. And the response was further investigation is required. Contact the agency. Tanya, you want to speak to this one?
I mean, obviously, I'm going to say yes. It's just say, high, because there's still a lack of resources to do these, to do these things, particularly with the noise enforcement. There's still a lack of staff, a lack of resources. So yeah, so I think that that needs to be addressed by the agencies, and it's multiple agencies, not even just DEP, but that's who we deal with here in this committee. But yeah, I think that I think there's still a lack of resources, and the staffing is a problem, and also equipment. I think that there needs to be more resources for the new technology that can be used to for the city to dedicate resources for technology to monitor, technology to sort of capture noise in our community, because there's so much technology going on. And I know that DEP actually has they're actually doing a pilot program in our community.
Oh,
Yeah, they are.
Right.
Already.
Yeah, we should we should get a report on that.
Yeah, okay, I can definitely ask them to come. You just tell me when, and I can definitely, because we just met with them. Our task force did.
Yeah, well, maybe we could have them come next month.
Okay.
All right, but should we continue to include air quality and water quality on this item?
Yes.
All right. Okay, so Tanya, you're suggesting that
I think that personally, my thing is, and I don't know, I felt that putting all of those things together, I don't know. I think that there are different problems, and I think there are different resources dedicated to those problems. That is just not similar. You know,
they're only tied together because they all fall
under DEP.
Under the same
Okay.
the same unit within DEP.
And there's
Okay.
also a huge risk right now for water quality because of what's going on at the Supreme Court.
Yeah, I know, but that gets a lot more attention and a lot more attention than the other issue, the noise issue, which doesn't get as much attention as it should, and it impacts our community directly in ways that are more pronounceable. I don't know. I just feel like, you know, again, it's going to be you know, I think that it's just different. You know, I'm not saying that these things are not important. Air quality monitoring and water quality testing is not important. I'm just saying that it's just different in terms of the resources dedicated and the attention and the legitimacy to the that there is a need and for more resources for that.
All right. Well, we are at least mentioning it first. Sally, what did you say?
The Supreme Court right now is debating things that will put water quality at risk.
Well, I'm sorry. Where is it at risk?
At the Supreme Court.
Oh. All right. Well,
a case we discussed yesterday.
Because of
I will not put I again, the things that are driving people in this community crazy and the things that are impacting this community right now is number one, is that thing. And the first mention. Yeah. And I'm not saying the other things are not important. And I'm just saying that the things that the community, again, I'm not speaking for my own self. I'm talking about what the community is concerned with and what there is a lot of direct impact has been that first one, which has not been tackled and does not have advocacy on the Supreme Court.
Neither does this.
Yeah. All right.
This is the opposite of advocacy.
Yeah. All right. Well, I tell you, I mean, we're not saying that. I don't want to play one against the other, but you are suggesting.
I'm not going to, but I'm saying that's what's important to the community. I'm not here about my own initiative. I'm talking about what's important to the community and what people are actually concerned about.
All right. But you're also suggesting.
I agree with Tanya.
Okay.
I'm a community. I live in the community, and I totally agree with Tanya.
Yeah.
The noise is definitely a greater priority to people's health.
Well, it's mentioned first. But Tanya, are you suggesting that we should also say increase staff and technology?
Yes.
Okay.
Yes, yes, exactly, and technology. Thank you. Yes, that's all. That'll I think encompass some one of the things because we definitely need more resources to do that.
Yeah.
All right, so
Tanya, this is Sandra. I'm also wondering because I spoke to a group that also raised the issue of a funding for an education campaign going along with the technology and measuring and enforcement.
Yeah.
In fact, at some level, that also would be helpful.
Yes.
Well, DEP already has an education program.
On noise?
Yes.
Well,
if you go I'll send it to you, but they already have a curriculum that's taught in school that should be, and we as a task force my task force is not affiliated with the board, has advocated for greater expansion of that education component and making sure that it's actually being part of the regular curriculum in the schools where it can educate not only parents, but the students and teachers and the community, basically. But the DEP has an already outlined curriculum already.
Is it being used in School District 6?
That's what
Well,
I'm trying.
Mhm.
No, go ahead, Sandra. I'm sorry.
No, I was saying, I mean, outside of the school, I think it's sort of a part of a community neighborly campaign.
Yes,
That's what I'm
yes.
Right.
really thinking
Yeah.
about. So I'd be interested.
Yes.
I'm just thinking with our environmental justice and other departments to look at, Tanya, at some
Oh,
of the
yeah.
DP report, because I think what we're talking here is really a community-wide educational campaign
Absolutely. Yes.
about wellness. This is a wellness issue.
Yes.
Okay.
Absolutely.
So
Yeah.
I think that's what it is. And maybe when it's phrased as enforcement, they're thinking of, does it mean adding more officers, adding more staff? What are we actually asking for? And maybe just looking at resources for, a true community-wide education campaign, neighborly
Good.
campaign.
I agree. I agree with that. Yeah. Maybe
Mhm.
that like staff, technology, and a community-wide education campaign. Just
Mhm.
like what Sandra said. I think that's correct. For real.
All right,
Sure.
All right, so we're gonna add that in here.
Yes.
Julio, did you have a comment?
Yeah.
Julio? Maybe not.
Yeah,
Okay.
no, I'm sorry. No, I was just gonna sort of echo what you have mentioned about not, and I know that no one wants to pin one issue over the other, but I sort of agree with Sally. I mean, the quality, water testing may not be of all that important or sexy for us now, but it has been a major issue in other communities and throughout the country. So I think that we, as a community, should not let our guards down and ensure that, that those things are done and continue to be done as necessary.
All right, thank you. All right, moving on to number 6, which was the board's number 20. Increase substance abuse services in our community, including opioid overdose prevention education and funding for syringe cleanups and collections. And the response was OMB supports the agency's position as follows. DOHMH funds a variety of services related to mental health, alcohol, drug abuse, and depression. We will review and assess the request for additional programming, which would be contingent upon available resources. So that's one of their stock responses.
I just have a comment on this. It seems, given the opioid crisis, it seems like this is pretty low in our list.
Well, it is number 6. But we could, if I hear the suggestion from you, we could switch number 3 and number 6.
Yep.
Agree.
Mhm.
Did I hear something from Sally as well?
Yes.
Okay, and you were in agreement.
Yes.
Okay, very good. All right. We've actually made a decision about something. Okay, number 7, increase HIV/AIDS prevention and treatment services and LGBTQ services in our community. And the response, it was number 45 on the board's list. We're not even supposed to go that high. Response here is a further study by the agency of this request is needed. Therefore, OMB does not take any position. That seems awfully strange. I assume we're going to keep this on the list as well.
Yes.
Okay, number 8, which is the board's number 44, was to increase funding for education and outreach on recycling, reuse and composting, as well as proper disposal of household garbage in our community. I would certainly like to keep this one on the list. As we reported last month, our recycling statistics have been on the decline.
Agree.
Very good. Thank you. Number 9, which is number 25 on the board's list, increase pest control efforts to eliminate rats, cockroaches, etc. in our community. Their response was, this request is not recommended for funding. No reason given.
Interesting.
I can only assume that they believe that this particular program is adequately funded and is working and is currently working effectively.
What if we put in a line that said exacerbated by outdoor dining?
Well, do we have an agreement on that?
Yes.
All right.
Obviously, I don't know about voting on that at all because I'm party to full, disclosure to a current legal action regarding that outdoor dining.
Well,
but so I'm just letting you know. But yeah, I wouldn't be opposed to, saying exacerbated by that. But just so people are aware.
Right. No, yeah, that's. I don't see that as necessarily being a conflict of interest.
Okay.
I mean, you're doing both of these things as you're not being paid to do either one of these things as far as
right. Okay. Yeah. Okay. So yes.
But I'm sorry. Who suggested the language originally? What, exacerbated by outdoor dining?
Yeah, that was me, Sally. I just figured it gives them something specific to respond to.
Okay, very good. Okay, number 10. Number 10 on our hit parade was to provide funding to ensure that all local public schools have multi-service health clinics with nurses and social workers. And that was number 38 on the board's list. And the official response was, further study by the agency of this request is needed, therefore OMB does not take any position.
Steve, I think in terms of what's been going on in our schools for the last 2 years, the need for these clinics has multiplied.
Yeah, I agree.
I think it's too low on our list, and I think we should really.
I agree. Where would you put it?
I'm trying to.
I would move down the trash basket.
All right, so that you would put this one as number 6. Is that
right?
Is that what I'm hearing? I think
what I would think.
Okay, that's what I heard. Okay, and then we have a new item that was suggested at the last meeting. I'm thinking that it came from OC, which is to hold workshops to educate landlords and supers on the implementation of Local Law 97 to reduce carbon emissions from buildings by eliminating fossil fuels and utilizing electrification.
That's a good one, actually.
It is a good one. But apparently OC no longer supports it.
No,
I don't hear her saying anything.
Oh, because I definitely.
OC, are you still with us? Maybe she stepped away. Okay, so but where should we put this one on the list?
Keep it where it is for now until we hear from OC.
Oh, I'm sure she supports it. Oh, God.
She's saying she cannot talk. She's on the phone.
She can't talk? Since when can't
right
she?
now, she's on the other line. I think.
Oh. Okay. All right. So trash baskets is now number 10. funding for.
Can someone unmute OC?
Well, she can unmute herself.
There's no one stopping her from speaking. No one can control that.
Okay.
All right, 1, 2, 3, 4, 5. Okay, so at the moment, we're keeping it as a number 11. Should,
Personally, I don't know. Personally, I'm just I looking at it. I mean, that's just again, just my opinion. I'm like the trash bag thing. I don't know. I just feel like maybe that one could be moved up. I don't know.
all right,
I don't know.
you want to make this one number 10 and trash baskets number 11?
Yeah, that's just my opinion. But again, people might have other ideas.
Well,
but
I'm not hearing any others. So I'm going to take yours. Okay, let's go down to the capital budget list. Although, you know, the trash issue, God, you know, trash issue is pretty heavy in our district.
it is. That's where I hear you. Yeah, it's just hard because I don't know.
Oh, she can't unmute herself.
Really?
No.
Yeah, that probably happened to me. I got booted out and I couldn't unmute myself either. She had to allow me to speak. So it's probably the same thing probably happened to her.
I can't do nothing. I don't have nothing to press to unmute her.
Should she redial in?
Yeah, maybe she should do that. All right, let's go to the capital budget. Number 1 on our list last year, number 4 on the board's list was to install green infrastructure such as bioswales to divert stormwater from the sewer system and address climate change issues in our community. The response was further investigation is required. Contact the agency. Well, I guess we should do that. But we should still, I assume we still want to keep it on the list. Is that correct?
Oh, yeah.
Okay, very good. Number 2 on our list was to construct a new garage for District 8 and relocated trucks from District 12 as quickly as possible to comply with the city charter's co-terminality mandate. I was thinking of saying here we should expedite the construction of this new garage. Maybe make the language a little stronger. Their response last time, it was number 12 on the board's list there. The response was, this project is included in the 10-year plan. Well, be nice if they could move it up.
Agree.
Okay, number 3 on our list, number 9 on the board's list was to expedite the replacement of old water mains and sewer lines in our community. Their response was, this project has already been funded, but the community board should reach out to the agency with more detail regarding this request. And number 4 on our list, number 14 on the board's list was somewhere here, was the to provide additional garbage collection trucks and street sweepers with snow plows. The response was, the agency has stated that they will try to accommodate this request with existing resources. OMB supports this.
Steve, on the previous item.
Yes.
About replacing old water mains and so on.
Yes.
Didn't the governor just sign legislation to fund the replacement of pipes which can rot for water mains throughout the state? And doesn't that affect this capital request?
Well, I think what I read is that they approved another environmental bond act, and that the money from the bond act, some of that money would go towards the replacement of old infrastructure such as water mains and sewer lines.
Okay, thanks.
I don't swear to it, but I believe that's what you're referring to. But so presumably it'll be on the ballot in November, and since it was approved by the legislature, it then goes to it has to be approved by the voters, and so we get a chance to vote on it in November. I hope it'll be approved by the voters, and some of that money should then accrue to the city of New York, I would assume. But I tell you, on this particular point, I think we've had a lot of work in this district lately on water mains and sewer lines, and they have been doing a fair amount of work. They've had over the last year, they had, I think, 4 separate projects. So I would change the language to say I don't know, continue the replacement of old water mains and sewer lines.
Do you know for a fact that the old water lines are not being replaced by lead?
I'm sure we're no longer using lead pipes.
I'm not so sure. I just don't know.
All right. Well,
in some places it's even required that lead pipes be still used.
all right. Well, I tell you what, I'll ask. Okay. No, I shouldn't assume it. I should ask. But since there is a significant amount of work that has taken place in our community on this point, I would move it down to number 4.
Mhm.
Did somebody mumble in agreement?
I agree.
Okay,
Yeah, I agree.
good. All right. So all right. So you want to keep bioswales as number 1? I don't know. I really want to move this all of those sanitation trucks out of Inwood. I really want to see that new garage built downtown. Okay, can we make that one number 1?
Okay.
Sure. That's fine.
Yep.
I hear you.
All right. So you want bioswales or garbage trucks as number 2?
Bioswales.
All right. So and then garbage trucks and then water mains. Okay.
Yeah.
All right. Very good. I think we've had a pretty good review of the priorities. Is there a motion to approve our revised list of budget priorities?
I make a motion to approve our revised list of priorities.
Second.
Mr. Mesa seconds. We will call the roll as soon as we find it. The heck did we do with it?
Can someone check whether they can unmute? Oh, let's see now. I think she redialed in.
Sally, there's no button that I can hit here. When I hover over her name, it only says ask to unmute. That means she has to unmute herself. There's no way that I can fix that. I don't want to have to repeat that again. I gave the co-host ability to you, Sally, and to Steve. If you hover over her name, you'll see the same thing that I'm seeing.
Okay.
I cannot fix that stuff. All the stuff that's happened tonight, it's not me.
All right. I don't even see her listed here anymore.
She's there, but I can't fix that. That's on the other side. That's like a user issue. That could be anything going on her computer, or she forgot to unmute.
Well, it says here that she's a co-host.
Even more so, Steve. You are too, and so am I. And when you hover over her name, you can unmute her. That's on her side.
Okay.
We've been using this for 2 years, guys. Like, come on.
Yeah, well, we still don't understand it. Okay. All right. Well, let's let's vote. Tanya, how do you vote on this?
Yes.
Is Catherine Diaz still with us? No. Sally Fisher,
Yes.
Jay Mesa,
Yes.
I vote yes. Oh, damn it. We really need OC's vote. Oh, God.
Someone can call her on her cell phone.
Yeah, thank you. Yes, they call her and just put her on speaker. And so she can speak her vote.
Hold on a second.
Yeah, but it has to be on speaker though. We have to hear her say it.
Can she at least?
We have to hear her say yes or
Right.
no.
But she can hear us, right?
If you put her on speaker. You'll just have to call. You'll have to just,
She can
call
hear us.
her.
She can hear
Okay.
us. I'm gonna
Okay.
call.
Oh, shoot. The number I have for her is no good.
I had texted her and that was fine. So, oh man, I can't say it out loud.
Okay. Hold it. Wait a minute.
So someone who is not using their phone should call her on their phone to get a verbal yes.
If Tanya has her number, she can call her and put her on speaker.
Okay, I found another
I'm
number.
using. Okay.
Oh, shoot. Hit the wrong button. Oh, what is this? No, this is not Tanya. This is Steve. Hold on. All right. Have you been able to follow the meeting?
Yes, I've been like, I heard all the conversation and I don't know how to unmute myself on the phone when it's not directly on the Zoom. So
Okay.
anyway,
Well,
yes, I agree with
all the changes?
yeah.
Okay. All right, 1 second. Can you hear her?
Yeah.
Yes.
Okay.
Can you guys hear me? I agree. With the ranking.
Okay. All right. So why don't I keep you on this line?
Sure.
Okay. All right. So, okay, great. That concludes that item on the agenda. We will revise our list and forward it to the board so it can be used at the budget hearing on the 18th. Okay. Under old business, we did get a report from DEP on the top 30 complaints from our community in August and September. I will forward it to the committee members. August, there were close to 1,100 complaints from our community, and not surprisingly, the top 3 complaints in August all involved fire hydrants, hydrants running full, hydrant running. The top complaint was fire hydrant emergency. I assume that also pertains to water running coming out of the hydrants. And in September, 200, a significantly reduced number of complaints down to 255. The top 2 complaints again involved running hydrants. And the number 3 complaint was construction noise before and after hours. On the street and sidewalk cleanliness ratings, we have somewhat of a surprise here. We have probably our lowest acceptably clean street rating in a long time for the board overall, 78.8%. And in a particular area, in the middle of Washington Heights, the rating was as low as 60.9%. Basically between sector 122, which is between 171st and 183rd Streets, east of Broadway, and then west of Broadway, basically from 171st Street up to Fort Tryon Park. This area had a low rating that brought down the entire district, 60.9%. And on sidewalks, we had an overall acceptable rating of 92.6%. I didn't get a chance to look up the recycling numbers. I'll do that and just send it to the members. Is there any other old business? Hold it a second. Nicholas, are you able to speak? Nicholas Artur has suddenly popped up on my screen. No, he wrote in the Q&A that he wasn't able to speak. I don't have panelist status.
That's not the case, because ever since I saw that message hours ago, I've been switching him to panelist. He must not be by his computer, because in order to do that, he has to click it. So now he is in front of his computer. And he can speak. I already said it. Any attendee can speak. All they have to do is unmute themselves. But I still transferred him over.
All right. Well. So then maybe he's not at his computer right now.
He has to be, because his picture just came to the panelist side.
Oh.
That doesn't happen unless he clicks on it.
Oh, I see. Okay. So, all right, Nicholas, can you unmute yourself? All right. Evidently he's having the same problem maybe that OC is having. All right, so let's
OC switched devices. She said she was on her phone. So unless Mr. Arturo left his laptop or desktop and went to a phone, I wouldn't know what the phone looks like. I only do this on the laptop.
Yeah. All right. Is there any new business? Are there any announcements? All right, so our next meeting is scheduled to be November the 3rd. And at that point, I believe Councilmember De La Rosa, or maybe a member of her staff, will be coming to present to us about the groups that have received funding through her New York City Cleanup Initiative. And she'll be discussing the work that those groups are doing. She's also holding a town hall meeting on Tuesday, the 18th, on sanitation. I believe the Sanitation Commission will be there. Unfortunately, that also conflicts with our budget hearing. So we'll get a report from either her or a staff member at the next meeting. All right, well, thank you all. We'll now bring this meeting to a close at
Motion to adjourn.
Excuse me?
Motion to adjourn.
Oh, very good. Okay, at 9:38. Okay, thank you all.
Thank you.
Thank you. Bye-bye.
Take care.